I'm elated to be with you all this wonderful Wednesday and welcome you to this really important and I think thought-provoking conversation that we have and that the wonderful Thelma D. Jones has brought to us this evening. I am truly honored to serve as your MC and facilitator for tonight's Thelma D. Jones Breast Cancer Fund pre-Thanksgiving support group meeting. And we will be discussing disability and breast cancer, an issue of health equity. This topic is very near and dear to me for a number of reasons. Of course, at the Washington Informer, I take a very personal responsibility ensuring that we are talking about the work being done to combat health inequities, not only in the district, but in the nation and world, and particularly affecting Black people, again, in the nation and world. And so, what Miss Thelma is doing here just gets me super excited. But it's also very near and dear to me because I know people who have or are currently experiencing breast cancer, either as patients, survivors, and thrivers, as we like to say, but also as caregivers. And I've also been a caregiver to many people struggling with challenges and those who are differently abled sometimes due to an illness, including my mom, who is navigating life post a brain injury in the midst of quite a challenging but rewarding career. Some of you all might remember my mommy. I still call her mommy at the big age of 34. But she is Bishop Paula Clark, the Bishop of the Episcopal Diocese of Chicago, and she was here with you all last year at this meeting. I see some head nods and look, if you didn't remember that, just looking at me, I'm sure you remember because I went and stole her face. God press copy paste. But for those who might not be familiar with my mommy, she's a native Washingtonian who was elected the first Black and first woman bishop of the Episcopal Diocese of Chicago. And I find her story really inspiring because when she was due to be consecrated, she had her brain injury 2 weeks before it was to happen, and it changed her whole life. And she had to learn how to walk, talk, write, navigate the world. And now she has 114 churches under her in the Episcopal Diocese of Chicago. But every day, is her figuring out how to navigate this world differently abled post a brain injury. And for a very long time, I was there with her as her caregiver. And now I'm just as her biggest cheerleader and seeing all that she's doing. So, this topic, Miss Thelma, again, thank you for making sure we're talking about this because, oh my goodness, it is so incredibly important. I call her a walking testimony about overcoming health challenges and, what some people might call disabilities. I like to call her battle scars. And that's what a lot of us have, right? Showing people what we've been through, right? Not only that we've survived, but we're thriving. And so tonight she sends her blessings and looks forward to being with you all again. And in the meantime, you get her Amazon the Amazon version of Bishop Paula. We have a wonderful program in store this evening, and I would like to thank our impressive lineup of speakers and really all of you for being with us today. I'm looking forward to hearing from our great lineup shortly, and there will be an opportunity for you all to ask questions. So again, be engaged, take notes, and feel free during the Q&A to chime in to what you're hearing. We'd also like to thank our sponsor, Mallory and Associates LLC, for sponsoring this event for the fourth consecutive year. Um, Under the leadership of Thelma D. Jones, Breast Cancer Fund board member Mamie Mallory, Mallory and Associates LLC is a management consultant firm founded in 2018, and it provides services in the following core competencies: transportation services, business process improvement, equal employment opportunities, civil rights, business development, and real property asset management. We are proud to have Mallory and Associates LLC's consistent support and staunch advocacy with people for people with disabilities as well. And just thank you for all you do. And this work and what we're doing today really aligns. And so we really appreciate Mallory and Associates. And before we dive deep in the program, I just want to give a little housekeeping, Zoom housekeeping. We all kind of know the rules. We remember 2020. It feels like it was 10 years ago, but it wasn't. So remember those things. This meeting is being recorded live on Zoom and on the Thelma D. Jones Breast Cancer Fund Facebook Live. The recording will be available in the next 24 to 48 hours for your enjoyment and for sharing. Many of you all may have seen me on Washington Informer TV, but I always say sharing is caring. And this is certainly a stream that we want to make sure our village is aware of and knows about. So sharing is caring. And also, remember just to remain muted if you are not speaking to help avoid background noises. I will be doing that as well because I have two loud dogs that want folks to know that they are actively engaged as well. So I'll be muting. Now, I wouldn't be doing my job if I also did not do a bit of promo for the Washington Informer. After all, I am managing editor. Now, are you all familiar with the Washington Informer? Some of you nodded when I said Win TV. Oh, I love these thumbs up. You guys with the pump up hands, always the praise hands. That makes me excited. Okay, good. So, as you all know, we are all about ensuring that we are uh, empowering the Black community with our stories. And so, thank you for supporting us as we amplify Black voices. That is the cornerstone of our. Oh, hold on! I got a Vanna White it, and look. Look at that. That is awesome. Thank you. um, but yes, thank you so much for your support. We are a multimedia company, Black woman owned. Our publisher, Denise Rolark Barnes, who I think is celebrating her 31st or 32nd anniversary as publisher. It was founded 61 years ago by her father, Dr. Calvin Rolark. And it was all about highlighting positive images for African Americans. And so we continue to do so, and we focus on positive news that educates, empowers, and complete pun intended, informs. We serve metropolitan Washington, D.C., reaching more than 35,000 readers each week through our award winning newspaper, as well as our website, digital platforms. And Denise's, which you all will see in the Informer when you get at the end of the year for our year-end edition. But her vision is we not only survived 2025, we're thriving and it's going to be fixed in 2026. And so we're here to be that voice for you all. So please subscribe if you are not. But there is one subscriber, at least two actually, that I know, and three, because I have to also shout out my Auntie Perry, who's my godmother, who's in the house and connected these dots for us. Love you. Um, so I know there's a few of us in the house, but if you're not, please subscribe. But one of our subscribers is Thelma D. Jones, and we are pleased to say that the Thelma D. Jones Breast Cancer Fund, yes, we can praise for that too, is a subscriber and recently took advantage, which was so awesome, in our special edition for health, wellness, and nutrition in August, and encouraged the Georgetown Lombardi Cancer Center to become an advertiser as well. So I'm about to talk about him in a second, but Ron Burke, our advertising director, wanted me to make sure I thanked you so much for everything, Miss Thelma, for your support. We really appreciate it. And if you're interested in advertising with us, please contact Ron Burke at rburke@washingtoninformer.com, and I will drop it in the chat. Or you can talk to Thelma and she'll get you plugged in with everything you want to know. She is the ultimate dot connector. So it will get done, I'm sure. And she'll also help you with subscribing or anything you'd like to know and to get in contact with me. I'm here with you all tonight all night long. You're going to hear my voice, so you'll get to know a little bit more about me. But there's so many exciting things. I want to get into the nitty gritty of the program. And before that, we need some comfort, we need some inspiration, and we need to know why we are here today. And that is because of Thelma D. Jones. And so, without further ado, I'm excited to introduce the lady that made sure we were here tonight, Thelma D. Jones, founder of this unique grassroots organization. Welcome. She's trying to get off of mute. I see your process. There,
Okay, I think I'm unmuted now.
yes.
Okay, thank you. But is my screen wide enough? Because for some reason my screen is down to a very minimal size. Can you see me?
We see you. You look great and you
Oh,
are accounted for.
okay, well, that's important. So thank you so much. And let's give Micha Green a hand for being here with us this evening. Misha's one of these people that I've heard her godmother, who's my next door neighbor, talk about for years and years. So I really feel as though I know you. We only met for the first time about six months ago, and now she's here doing a wonderful job in not only representing the Washington Informer, but representing Bishop Paula Clark, who I know is very proud of her outcome of you and you as well as her mother. Um, as Paula mentioned, as Micha mentioned, I am the founder of the Thelma D. Jones Breast Cancer Fund. We started first as a support group and we evolved into a full-fledged organization thanks to wonderful people like the ones who are here on this line on Facebook Live and who may have other devices there that are connected to. So I welcome and thank you for being a part of who we are, this unique grassroots organization whose mission is to advocate and improve the overall well-being for women, men, and young girls. And we do this through outreach, education, and support in an effort to help to reduce the incidence and mortality rates of breast cancer. As many of you may know, though, our nation's capital has one of the largest mortality rates around breast cancer. and it's greatly impacting Black and Brown women. So I take what I'm doing as an 18-year survivor very seriously. It is a promise that I made to the Almighty that if He took me through this from the day that I had the surgery back in 2007, uh, my conversation and pact with the Almighty was that if you take me through this, I promise you I will dedicate my life to helping to prevent others from having to endure what I am going through and to raise great awareness of breast cancer. And I'm always pleased that I can go to bed at night or anytime during the day knowing that I have never, not once, defaulted on my promise and commitment to the Almighty. And one of the reasons why is because of great people like you believing in what we are doing and helping to support us. Our vision is to save lives and to embrace and achieve a world free of breast cancer. I am pleased that we are not only getting our message of early detection saves lives and creates better outcome here in the Washington, D.C. area or nationally, but also globally. I, my global help comes through the World Bank Group, which is where I retired from after more than 33 years. But in addition to that, because of people who care and support the Thelma D. Jones Breast Cancer Fund, we have now reached 7 countries. And I don't just mean we were just there, hit and quit. We are going back, we're reaching out. So we have in Bermuda, Jamaica, Mexico, St. Croix and the Virgin Islands, Spain, Guatemala, and more recently, Panama City, Panama. Thanks to Mamie Mallory, who is unable to be here tonight because she has a double commitment in Panama City. But one of the things that she was doing as a guest speaker, rather than, as Mamie said, doing all of the speaking, I want those organizations that I support, care about, and believe in be a part of my speaking commitment. So she asked for me to video a 2-minute part about the Thelma D. Jones breast cancer so that it could be played at the conference in Panama City. So I'm so happy to have been able to reach out to Panama City. And no offense, it was the Omega Psi Phi fraternity to the other fraternities and sororities. So the Thelma D. Jones Breast Cancer Fund does its work through a number of ways, but 2 of our signature programs are our monthly support group meeting that has been happening since April of 2010, and we've only missed 1 meeting, and that was due to transportation issues with public transportation. And speaking of transportation, it is one of the greatest barriers to care for breast cancer survivors and other people who are seeking health care. So you can see why, if it shut the city down, we were unable to have that 1 meeting. Our other signature program is our COVID outreach meals program. Since March of 2020, or when COVID started, we have been providing meals and bags of fresh produce to seniors, families, breast cancer survivors, and other people in the immediate area of Southwest and some parts of Southeast, thanks to our dedicated volunteers. We think that is so important. And as many of you have heard about the food insecurity issues that we were facing prior to the shutdown, and that's still going on. So we're very pleased that we're doing our share to help reduce the food insecurity challenge in our area. And I invite you to be a part of what the Thelma D. Jones Breast Cancer Fund is doing. We welcome your donation, any amount, small or large, from a financial standpoint. And we also welcome your human capacity and or any skills, talents, and abilities that you have that can help us with our mission and vision. Feel free to log on to our website at www.tdjbreastcancerfund.org. And I'm happy that one of our speakers tonight from Parachute will be telling you about an opportunity that can really help you, that can really help us to not only achieve our goal, but to grow and become even a more sustainable nonprofit organization. So let me just thank everyone for coming, and particularly thank our sponsor, Mamie Mallory and Mallory Associates LLC, and all of our outstanding guest speakers who will be coming later on. So thank you, and I'll turn it back to you, Micha.
Thank you so much for telling us about all the fearless work that you're doing. And again, the inspiration behind it. It is so incredibly inspiring to hear your journey and how not only are you surviving and thriving, but how you're using your journey to empower others. So thank you for that. All right, speaking of more inspiration, which I think we really need in this day. So I am having a wonderful Wednesday because I know that we're getting a lot of good inspo today. We have the Reverend Dr. Beryl Dennis with us of Beryl Dennis Ministries, LLC, who is a faith leader, cancer survivor, and advocate for family caregivers everywhere. And she is an author, an ordained minister of the gospel. And Dr. Dennis has published a devotional, Caring for the Spirit of the Family Caregiver. Oh, I love that title. You know, there's always ordained people with the good titles, y'all. Dr. Dennis engages with family caregivers at assisted living facilities, churches, and conferences. She holds a Bachelor of Arts degree in religion from the University of Richmond and is a Master of Divinity degree from Wesley Theological Seminary. Dr. Dennis completed a research workshop at Duke University Center for Spirituality, Theology, and Health, and holds a Doctor of Ministry degree, again, from Wesley Theological Seminary. And we just thank you so much, Dr. Dennis, for being here to provide some words of comfort.
Thank you so much for a lovely introduction. And I'm just really glad to be here with everyone. You know, this time of year is a reminder of the importance of gratitude. And I am so grateful for the strength and the resilience of each of you sitting here. You have your journeys, you have your stories, and you are here. And for that, we have a lot to be thankful for. I am celebrating 24 years since my diagnosis. Praise the Lord for that. You don't think of how many years have gone by since 2001, but I counted it 24. So thanks be to God for that. Let us bow our heads in prayer. Heavenly Father, we come before you with grateful hearts, thanking you for the gift of life and strength to face each day. We lift up our sister Thelma D. Jones to you, asking for your continued blessings upon her. May she be filled with your love, your peace, and your strength as she continues to lead and inspire all of us. Lord, we gather to discuss the important issue of disability and breast cancer. And as we do so, we ask for your wisdom and guidance. Help us to understand the challenges faced by those living with both disability and breast cancer, and to work towards health equity for all, God, because we know that that's what you would want, health equity for all. Your word in Psalm 34, verse 18 reminds us the Lord is close to the brokenhearted and saves those who are crushed in spirit. So we ask that you draw near to those among us who are hurting and provide comfort and healing to each person. In Isaiah 40:31, you give us another promise that those who hope in the Lord will renew their strength. And not only that, God, but they will soar on wings like eagles, and they will run and not grow weary. They will walk and not be faint. Oh God, we ask that this promise be a source of encouragement and hope for all of us. As we approach the Thanksgiving holiday, let us be mindful of the many blessings in our lives. Give us hearts of gratitude and compassion for others. Help us to support one another with love and with understanding. In Jesus' name we pray. Amen and amen.
Amen. Reverend Dr. Beryl Dennis. Look, if we didn't think we got a prayer today, we done got some prayer. Oh, wow. I am so fired up and thank you for that. So many things that I will take with me as we continue in this conversation, but also in my prayer life, this health equity for all. We gotta pray for that. Wow. Thank you so much. So now Miss Thelma told me to give little fun facts about myself throughout the night so that you all would learn a little bit regarding, my journey. So I'm going to start with a fun thing, and that is that I am a Zumba instructor as well. Look, we're talking about health. So maybe throughout the night we'll do some little side things just to make sure that you all are with me. But that's my first fun fact of the night is that I do Zumba. All right. Without further ado, I am super excited to introduce our next guest, Regina Blye, who is chief. Yes, clap it up for Regina. Yes, which with the awesome fall colors. I need some good greens in my life. Regina is Chief Program and Policy Officer at the Christopher and Dana Reeve Foundation, where she leads national strategy and oversees the operations of the National Paralysis Resource Center, a federally funded program that equips individuals and families with the resources, information, and support needed to live full, healthy, and independent lives. Her leadership is both professional and deeply personal. After surviving a C6, C7 spinal cord injury at age 10 due to gun violence, Regina transformed her experience into a lifelong mission to advance disability justice and strengthen community supports across the country. Thank you so much for that, Regina. Um, With more than 20 years of national impact, Regina has shaped disability policy under three U.S. presidential administrations, Obama, Trump, and Biden. And she was appointed by President Obama to the U.S. Access Board, where she served as vice chair, helping to advance national accessibility standards that continue to guide infrastructure and civil rights protections today, which we know is so incredibly important. She serves on the board of the Center for Medicare Advocacy and Women Enabled International, bringing national thought leadership to issues of disability, healthcare access, and gender justice. Based in Houston, Texas, Regina is known for her clarity, courage, and commitment. I'm gonna call those the three C's to elevating the voices of people with disabilities. She is a respected executive, a national advocate, and a joyful presence in every room she enters. And we call that including Zoom rooms, because look at her all fired up and ready to go and bringing us this joy. Without further ado, Regina Blye, thank you.
Oh, thank you for that warm introduction. That was so kind. I can't tell you how excited and thrilled I am to be here today. While I'm talking, I had like last minute, I had this idea to go through and try to search for pictures to spark some reminders of our time together. So Sergio, whenever you get a chance, it's just random. You're welcome to throw up pictures as a reminder of some of the events that we participated in. But as mentioned, I am Regina Blye, and I am deeply grateful to be here on this very special Thanksgiving gathering for the Thelma D. Jones Breast Cancer Fund. Before I go any further, I really need to start with gratitude for Miss Thelma. She's been a mentor, a friend, and a steady light in my life. You're so loved, and everybody knows you. And the beautiful thing is that you know so many more people, and in that big wide circle of yours, you still remember my name, and I think that is so fantastic. I'm thankful for you, that you think of me and that I'm still in your circle and I get to be with you today. Your decades of work, your commitment to health of women of color, and your unwavering focus on survivors and thrivers have changed lives and built a community. I'm honored to be able to pull up and pull from your strength and to learn from you as an example. And I truly celebrate you. I also want to thank Sherry. I want to thank you for your courage and your leadership and for being a longtime friend and advocate, and also for Miss Mallory for her steadfast support of the foundation. Because without being support of the Cancer Fund, we wouldn't be able to have these types of gatherings. And most importantly, I thank you for welcoming me back. So great to see so many familiar faces and even the names. I'm just so glad to be able to see them. Once in my life, I was an ambassador, and I had the privilege of facilitating this very meeting. So I'm so very glad to be back in this space, and it really feels like I'm coming home. Today's theme around Thanksgiving, it's giving thanks for being alive, for being present, for being remarkable and complex, beautiful, all those things all wrapped up in one. And Thanksgiving, unfortunately, isn't about being soft and sentimental all the time. It also gives us an opportunity to really be honest and brave. So I want to take a few moments to share my truth. So for over a year, I've been navigating a deeply personal medical journey. Doctors found a growth in my stomach area, and I've gone through biopsies, repeated tests, given more vials of blood than I even think I could count. And I've been told right now I don't have cancer, but at one point I thought that I had it. And so I sat with probably some of the same questions that many of you have had. What would it mean if I did have cancer? What would treatment look like? Who would I tell? And how would it affect my work, my future, my life? On top of that, it's taken over a year just for me to get an MRI. Still waiting on it. I'm supposed to probably have it in next week, but fingers crossed, because every time I think I'm gonna get it, I get a rejection. And part of it is because I move around so much. And because when you have an MRI, you have to be very still. And it has taken almost an act of Congress for them to be able to write the types of prescriptions and prescriptions I need so that I can be sedated or under anesthesia, whatever it is for me to be knocked out so that I won't move through the MRI. That MRI is stopping me from having my surgery to remove the growth that has been growing for over a year. It's caused pain, it's caused heartache, it's caused I don't know how many things, but I've managed. Nobody has really known. This is my first time saying this out in public. Mostly, I've been worried about sharing it broadly because I didn't want people to think of me differently or quietly decide that they didn't think I was capable or no longer able to do leadership opportunities. And these are some of the same struggles that people face when they get these types of diagnoses. They're afraid to let people know that they are quietly battling with something in public. So private battles in public is what happens all the time when you get diagnosed and have cancer. Or if you're just trying to figure out whether or not you have it or not, it is a struggle. And it's the reason why it's so difficult for people with disabilities to get diagnosed on time. We have hard data showing that women with disabilities are less likely to receive routine screening like mammograms compared with women without disabilities, which means cancer can be caught later, which means treatment is going to be harder. One study found by the CDC that screening rates for women with disabilities at 61% compared to 72% for women with disabilities. We also know that people with disabilities who develop breast cancer can have worse outcomes. One major study found that patients with disabilities had a risk of mortality than those without disabilities. And this is all because it's so hard to be treated. It's so hard to be able to get doctors to understand the care. That's that health equity in place. So then you layer on race and disparities, and it only widens the issues on top of all of what's going on. Diagnostic equipment is often not designed for those of us who use wheelchairs. Providers are not always trained to transfer a position as safely. Imaging and exams can be less effective or not even timely. Again, a year to have an MRI. For people with darker skin, visual cues can be missed. For people with complex needs, some doctors simply don't even want to take the time to be able to help them. And Sherry brought up a point in an email where she reminded me when COVID happened, doctors made difficult decisions about who they were going to treat and not treat. And most of the time, people with disabilities were on the other side of being treated, and they didn't survive through the COVID period. And so this is why it is so important for us to have this type of partnership between the Christopher and Dana Reeve Foundation and the Thelma D. Jones Breast Cancer Fund. It is so important. Over the last 8 years, we've shown how these meetings have transitioned and transformed many people. The consistent presence matters. It matters. It matters. Our shared work matters. Through our partnership, both organizations have been able to emphasize that people with paralysis and other disabilities are not an afterthought. We are central to the conversation about health, about our access, and about our survival. So as we begin, I invite you to this space of thankful truth, thankful that we are here, honest about the barriers that we have faced, grateful for leaders like Ms. Thelma, who have poured into this community for decades, and committed to building a world where early detection, accessible equipment, and disability competency, cultural awareness, and a care standard is not special. I am thankful, I am blessed, I am fierce, and I'm here. Thank you so much.
Thank you. You are blessed, thankful, and fierce, and here. And oh my goodness, this is just such an inspirational conversation. I don't know about you all, but I've written down this phrase, and I hope you all can put it in your notes on your phone or somewhere that Regina just gave us. Thankful truth. I don't think we need to be walking around in thankful truth this season, maybe into 2026. But we need to be, as she said, this presence matters, our collaboration matters, and our voices matter. And so, thank you, Regina, for your fearless, fierce advocacy. And I know we'll hear a little bit more from you also at the end. Okay, Miss Thelma again has me sharing facts about myself throughout. So the next one I'll say is that my favorite color is purple. I'm putting it, I have a little on today. Okay. Oh yes, 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 yes. So that's what I did the purple and pink, and of course, for breast cancer awareness. But I also did it because this month, I believe, is pancreatic cancer awareness, which we know there's major disparities in the Black community, and the color is purple. So I tried to do the purple and pink together for that. So that's my next fun fact. All right. So without further ado, we have Dr. Vovanti Jones, who I'm really excited for you all to hear from and pick Dr. Jones's brain. Dr. Jones completed a medical degree from Washington University in St. Louis and went on to complete a residency in physical medicine and rehabilitation at Schwab Rehabilitation Hospital in Chicago. Now she is an assistant professor of physical medicine and rehabilitation at University of Missouri, and the medical director of the inpatient stroke rehab unit at Rusk Rehabilitation Hospital and co-director of MU's Neuromuscular Clinic. I am super excited to hear from Dr. Jones, and I know that we'll get to ask questions. So again, if y'all are like me, I gotta write my stuff down. So listen and engage with Dr. Jones, and then afterwards. And without further ado, the awesome Dr. Vovanti Jones.
Hi, everybody. It is great to be here this evening to be able to talk to you about cancer-related disabilities. I really am thankful I'm here, especially just to hear Regina and your last comment, because I actually just came from giving a lecture over to some students at the university about disabilities in medicine. And one of our topics really was about what you mentioned, the fact that individuals with disabilities are more likely to be diagnosed later, have less access to care, less access to equipment, um, and really my goal was to talk to these students about, internalized, well, ableism, and the fact that the healthcare system still has a lot of that built upon it, and can lead to individuals with disabilities having such negative outcomes. And so just to hear your personal story and see how these things are going, it helps kind of fire me up to talk to these healthcare systems about how do we better serve our population. And I believe the important part about that is getting to people at much younger ages without having these old white-haired people oftentimes that don't, have their mindset about things, especially when we're having the more advent of technology and better ways to interact with your healthcare system. So I think it's great that I was able to hear your story today. It kind of like, again, just reminds me I just talked about these things. So I have a little bit of a PowerPoint here that I could put up, or I can talk to you about these things too. Because really what I wanted to talk today about is really the idea of cancer-related disabilities and cancer rehabilitation. So I'll put up the PowerPoint and kind of talk through there if you give me the chance to share real quick. If not, I'll just talk through it. But here we go. I'm going to share my screen. Let us put this in PowerPoint mode. And then
just take your time, and I'll fill the space with some fun facts. So Vovanti Jones is one of these people that I knew her almost before she knew herself, because her dad and I are her father's the closest high school classmate I have, from the class of 1970, graduating from what is known as a Rosenwald School in Snow Hill, North Carolina. This is Vovanti's third time speaking at one of our meetings. She started off with, I think, greetings and open remarks. Last year, she graduated to being the mistress of ceremony, and this year she is a guest speaker. So I don't know what role we'll have for you next year, but we just want to keep it going. Okay.
okay, well, you guys can see my PowerPoint now. Make sure that's up. All right, well, my goal here with this talk is really to go through a couple things, kind of defining a bit about what cancer rehabilitation is, talking about some of the common cancer-related disabilities, and reviewing evidence-based and some evidence-based interventions that we know of, and just understanding a bit more of that cancer care pathway. So when we look at cancer rehabilitation, we have to go back and look at the numbers. And so we know that as more and more cancers are being diagnosed, with some being diagnosed a lot sooner, that there's a much larger population of individuals who are going to survive this cancer diagnosis. So when we look at the United States and we talk about 18.6 million individuals who are cancer survivors, and this is expected to exceed over 22 million by the year of 2035. So that's 10 years down the road. We're adding more and more people that are surviving their initial cancer diagnosis and treatment. But we know survivorship does not mean that necessarily you are the same person, the same state that you were prior to your cancer diagnosis and your treatments that have gone through. And with this, we know that as you have more people, we're starting to see that there's more prevalence of functional impairments. And so when I talk about functional impairments, I'm talking about from problems with mobility to just being able to do basic things like self-care, going to the bathroom, do your own hair, getting dressed. Those are becoming more prevalent. So there have definitely been large-scale studies that show that when we look at our cancer survivors, about 27, almost 30% of individuals have some type of mobility disability, and at least 10% have some self-care disabilities. So overall, those rates are much higher than in the population of adults who don't have cancer. Really, if we look at it, about 1 in 4 individuals in the United States, adults, are going to have some disability. But it varies largely upon, with only about 13% of that being mobility disabilities. So you can almost see that those rates are a little more than doubled in the cancer population. So when we look overall, we just know that as it currently is, more than 5 million survivors are living with some type of mobility disability. So with this, we know that there are unmet rehabilitation needs in oncology and in our cancer population. So by identifying those things, we also talk about, well, what is cancer rehabilitation? So the general form of cancer rehab is that it's a supportive healthcare plan program that helps patients maintain and restore function, and as well as quality, helping to improve quality of life during or after their cancer treatment. The goal is to restore, like, again, function, quality of life, and increase participation in life outside of every thing, whether getting back into your community, doing the things that you like, the things that overall make you human. And so it's not just a one point in time on your cancer journey, it actually has multiple steps. And so oftentimes what we'll say, it's got these 5 phases: our prehabilitation phase, our acute phase, our subacute phase, our survivorship phase, and our palliative care phase. And so we'll go into a little bit more about that, but our prehab phase, we really talk about right when you get your diagnosis, before you start treatment, before you have any big surgery, what are we doing there? So cancer rehab, the goal is to address several areas, address the physical challenges that may occur. So in things like managing disease, weakness, fatigue, joint issues, balance problems, or, if you've had surgeries, managing, some bone cancers, you might have amputations and other things like that that you're going to have to rehab from. Also cognitive issues that may happen, people talk about that chemo brain that may happen, memory problems. And some of these are also very specific to the types of cancers that are out there. Emotional well-being, anxiety, depression are major, can be major components along that course of dealing with your disease. And then also looking at your daily activities, tasks like eating, writing, self-care, and then treatments of treatment-related side effects. So how do we manage those side effects, things like lymphedema, incontinence, or nerve issues? So we talk about like what can lead to some of the impairments in individuals who have cancer, what are and need them to rehab. A lot of things are the tumor burden affects itself. So depending on the type of cancer that you have, like a brain cancer, a small tumor can have massive effects compared to maybe a small uterine tumor, right? And so even going in and a brain cancer and removing that, you have risk to damage to the surrounding areas that can really affect cognitive, but also all body functions in a brain cancer, which would not be necessarily the same as, like I said, a uterine or ovarian cancer type situation. But those, and then the size of the tumor itself, the compression, other things like that have their own effects. The other thing we talked about was the chemotherapy, radiation, and your surgical impacts. So chemotherapy in itself, because of its wide-ranging effects, oftentimes nerve damage is a component of it. I have patients that come to see me in clinic because they've had chemotherapy oftentimes for breast cancer, and due to the type of therapy that they've had, they have a neuropathy or cancer-related neuropathy, nerve damage, that have led them to have things like pain, but also weakness, and things like foot drop is very common that I see in their leg because the long nerves are affected the worst. And so they can't walk or have trouble walking because their feet drag. And so we have to do bracing and other things for that. Radiation. So direct radiation treatments. I have patients who have had radiation for lung cancers, and it affects the nerves of their arm and shoulder. And so they're not functioning there. So we have to rehab them for a different area, not where the cancer is, not the lung, but I'm rehabbing the arm because of how those nerves are affected because they overlie the chest. And then toxicities related to immunotherapy and other targeted therapies that they have out there. So looking at that, we talk about, well, what are the areas of functional impairments that people can have? So the physical areas, so when we talk about strength, endurance, and balance, but also neurologic areas. So motor movement is actually falls under neurologic because it's often nerve input that allows that movement. So motor and sensory deficits, cognitive deficits, like I mentioned earlier, and psychosocial deficits as well are the areas that we talk about. So just to focus on a few of these areas, we can talk about musculoskeletal disabilities. So often post-surgical deficits. So like I mentioned earlier, if you, depending on where your cancer is, like I mentioned the leg tumor, you have amputation because of a tumor, you're going to need some type of prosthetic device. So dealing with what it is to be an amputee and the complications that can come from nerve pain and other issues that can come from being an amputee, to being able to get them back to having a limb and participating, you know, walking around their home, doing their care there, but then maybe getting out in the community to maybe, you know, next year's Olympics again. So Paralympic sports, we have some athletes with disabilities or amputees that are getting back to being active in the community, managing those things. We talk about lymphedema in the upper and lower extremities. We know that when you don't have good lymphatic drainage because of radiation and other issues, you can have swelling in those areas, which make you feel weighty, difficult with mobility, can be painful, can get infected. So those are things that we have to be on the lookout for. And oftentimes that requires special garments and wraps or massages to be able to manage those things. Bone metastasis can cause pain, can also cause fractures. We know prostate cancer very commonly metastasizes to bone and can lead to spinal fractures, which have their own problems. And then, you know, we look at ways to how do we modify mobility or produce other strategies to allow you to still be able to function. Next, neurologic and pain-related disabilities. So chemo-induced peripheral neuropathy, as I mentioned earlier. And then radiation plexopathy. So when I was talking about the upper arm in that individual, the brachial plexus is a combination of nerves in the chest, upper chest to the shoulder and arm. So when you get radiation there, it affects arm function. And you know, if your arm's not working, things like daily activities, tasks, even wiping your butt in the bathroom can be difficult if it's your dominant side. Then we talk about different types of pain, from nerve pain to just pain related from surgeries and removing the tumor itself, and then just the dosing of the treatments that you have. Other things we talk about, cognitive and fatigue related issues, cancer-related cognitive impairment, whether it's from the cancer itself, whether it's from the swelling around the tumor, or whether things related to treatment that may happen. So we know like brain radiation, targeted radiation has less side effect, like in the brain, targeted tumor radiation has less side effect, but oftentimes, depending on if you have multiple areas, you may get whole brain radiation, right? And whole brain radiation affects not only the tumor, but everything else that works around it. And so everything else around it is irritated, and it can lead to abnormal signaling and side effects like seizures and things like that. Fatigue is often multifactorial, not from the energy that, you know, a tumor may use up to build itself. It takes a lot of energy because it's rapidly dividing cells, depending on the type of tumor. And then the fatigue from your treatment, depending on where lungs, you know, lung cancer is going to cause more respiratory problems. That's going to cause more fatigue and things like that. So those are all the things that we're seeing. So there's some evidence out there, talking to a rehab specialist about some of the things you can do for fatigue management or compensatory strategies if you need them. So one of the things along that 5 pillars of rehabilitation is this pre-rehabilitation or prehabilitation. And it's really the idea of, can we bring people in to condition people prior to their surgery and prior to their treatment? So I run an inpatient rehab unit, and there are patients that we often screen and I bring in who we know we have a diagnosis of breast cancer, or I know I have a current patient right now who has a diagnosis of lung cancer. And what we're trying to do in the rehab setting is they've been in the hospital and they've been debilitated from that cancer. The surgeon wants to try to build up as much strength as we can before we put them through the process of treatment, putting them through the chemotherapy again. Or this patient I have is coming in between his treatment sessions. So he had a session, got down, we're trying to treat him, build him back up so he'll be prepared for his next section. So that's the kind of things that we can do on the rehab setting. So overall, the goal of prehab is to improve. We know outcomes have shown from research that they improve preoperative functional capacity, improve recovery, reduce complications, and can reduce hospital length of stay. The main components here is to combine these ideas of a tailored exercise program, nutritional counseling, and psychological support. And it can be done by telehealth too, as, to help with burden of people not being able to make it in to the hospital. We talk about also what are some exercise oncology principles. So the American Cancer Society and American Society of Cancer Oncologists have had a variety of guidelines that you could even look up and find online for cancer rehabilitation. Main ideas is focusing on aerobic activity, strength, and flexibility. Identifying any contraindications or red flags. So I talked about people that might have Mets to their bones. So if you got a bone with a metastasis in it and it's high risk of fracture, I might have to modify exercise, weight bearing, things like that. And then tailoring to the treatment cycle. Where are they in their cycle? Are they on a break? Are they in the heavy part of their cycle? How do we address things? Often this can be seen done in the inpatient rehab setting or subsequent outpatient physical occupational therapy. And we know it has led to significant improvements in quality of life, function, and then even social participation of cancer survivors. So there are a few safety populations that we have to keep an eye on. So if you're in your treatment and you got neutropenia, we have to do infectious precautions to reduce your risk. Mask. Sometimes, depending on how low you are, you might end up on prophylactic antibiotics to reduce your risk of getting infections. Thrombocytopenia, that is low platelet counts. So that puts you at increased bleeding risk. So you might have to do less activity, less stressful things to decrease your risk of bleeding. Anemia and fatigue reduces your overall tolerance, oxygen load. So you have to be careful about that. And then bone fragility, like I mentioned, metastasis to the bones and other areas can lead to fractures, and we have to watch out for there. So overall, the idea is interdisciplinary care model where the physical medicine and rehab physician like myself, our physical therapist, occupational therapist, speech therapist, depending on the type of issue, like head and neck cancers are more likely to see a speech therapist than a breast cancer survivor. Input from oncology and nursing, our palliative care colleagues, social work, vocational therapy if we need to do that, and then survivorship programs and support groups are important. And we know we talk about this, but palliative rehabilitation. So this is also brought in, well, palliative care in the cancer setting should really be brought in early to just talk about all forms, because oftentimes people think about palliative care as end of life, but palliative care is not necessarily hospice. Those are different things. Palliative care is for individuals who have either a disability or illness that in the long run may affect their overall lifespan and activity, but it doesn't mean it's necessarily quick. But the idea of palliative rehab is where you change your focus of from long-term restoration to optimizing function to achieve immediate and patient-centered goals. And when I mentioned this is form that are later in the cancer care. So goals might include maintaining strength to perform basic self-care activities, managing pain so you can have more meaningful social interactions, or preserving mobility for safe transfers at home and being able to stay at your home as long as possible. Again, the American Society of Cancer Oncologists really have clinical oncologists basically have guidelines that go forth to this. So overall, just kind of wanted to leave you with these key takeaway that early rehabilitation often improves outcomes. Everyone needs to be systematically screened for this if they have the cancer diagnosis. Tele-rehab and digital monitoring is growing. And I wanted to leave some time for questions and discussions at some point when you're able.
Oh my goodness. Dr. Vovanti Jones, you should see my notes. You would be very proud of me as a professor. I learned so much. Thank you, thank you, thank you. And again, thank you for sort of connecting these ideas and all that we're learning today from Regina's amazing presentation and the work you're doing. Gosh, I need show of hands or head nods. Were you all familiar with cancer related rehabilitation?
Not,
Okay, good.
yeah,
Okay, because I was sitting here like,
mind
how
blowing.
have I never?
Yeah.
So, I'm gonna open this up to questions because I know folks have a lot, but I want to honor the first in the chat, which is from Mary, who wants to know, Dr. Jones, this content is excellent. Would you mind sharing your slides?
I do not mind. I will send them to Miss Thelma, and then she will be able to get them out to everyone.
Awesome. Wonderful. Thank you. I know we all are very thankful for that. And Mary has said thank you in the chat. Does anyone want to, you can use the hand raise feature. Oh, Miss Thelma, you have a question.
Yes. Thank you so much, Vovanti. I mean, I was overwhelmed um, at all that I was learning and or hearing, because it was looking at oncology and cancer from a totally different perspective. It's very informative and educational. I'd like to know, earlier when you started speaking, you mentioned that you were talking to a group of students, and that just kept resonating with me. What else can we do to help raise greater awareness of the overall challenges of people with disabilities? Because I'm now thinking, wow, I'm not beating myself on the head thinking we only have 1 month that's dedicated to it. I know that there are other things that we can do. And if this is a conversation that we should have offline, fine. But if there's something you can share with us and everyone else, um, to raise
I
great
always,
awareness.
yeah, I always think it's important, especially when we talk about in the healthcare setting, is that it's important for people to have exposure to people who have a variety of different disabilities or from a variety of different backgrounds as a whole. And this is important, I think, in their educational process over at the School of Medicine and whatnot. You guys are, well, you're in the DMV area. So when I was talking to some students over at Howard, they don't have a rehabilitation department, but GW does, and Hopkins does. And so I think it's important that as patients or individuals who had some disabilities, that you be open to reaching out to some of those programs and saying, hey, we want to talk about, breast cancer survivorship. We have a couple people that are willing to come and tell their stories. I think that is the best way. And the best part for me in medical school was being able to talk to people and hear their experiences and hear some of the things that they went through. And I could take that feeling or understanding with me when I got into the clinical setting. So I reaching out to programs or schools that would be great.
Thank you. That's a great suggestion.
Is there any progress and movement to include more education at the college level? Because you mentioned started earlier. Are there courses that,
So there are actually schools that have colleges that have disability programs. I know the University of Illinois is Chicago is actually has their own, it's like a certificate program or something there for disabilities, like a disability studies program. So there are some schools that do have that. I would say, not globally, but across the country is not enough. Definitely not enough of that. But there are some places where it thrives.
Awesome. Karen, I see your hand.
Hi, Dr. Jones. Very good message there. And I did not link disability and having cancer and being diagnosed and going through rehabilitation, I didn't connect the dots with that until I was filling applications. And then it asked if you have disabilities, and cancer was in the box. And so that was recently. I'm like, okay, I'm not saying that I would qualify or anybody would qualify for benefits, but I didn't realize that those two are connected. So I was very shocked to learn that, and that as far as rehabilitation, I guess depending on the type of surgery you have, I had to go do rehab because I had to strengthen that muscle from the. I'm a breast cancer survivor 2 times, and so the surgery I had to go through rehab to strengthen that muscle. And then the lymphedema that I started having, I had to wear a sleeve and get that circulate because I had some lymph nodes removed, and so I had to um, learn techniques to get that circulation going. So it's definitely a need for what you're sharing because I mean I guess I was fortunate and blessed that my doctor recommended. Well, I had to go to rehab to strengthen that because I had to lift my arm to keep my arm get my arm back to the reach span that it used to be. And then the lymphedema, I don't wear the sleeve as much anymore. I just keep massaging and try to make that fluid flow. So I just kind of massage, but definitely, it's definitely a need and it's an eye opener. I did not know that the two are connected. Or so. Thank you for the information. Appreciate it.
You're welcome.
And thank you, Karen, for sharing your testimony and what you've been through with this. Sylvia.
I just really want to commend Thelma for having this on her agenda, dealing with breast cancer and disabilities, because as Karen was stating, that you don't necessarily put the two together, and it just happened as I was preparing for this uh, event. I was talking to my cousin and I'm getting ready for Social Security. So we were going over just little life things. And she told me she had been getting Social Security for like 20 years. And I was like, okay, but I'm putting her age together, but she's a 2-time breast cancer survivor. And she had some issues with her heart and some other things after the breast cancer. And then it just jolted me that had put her in position that she was disabled because of that. So I think it's really important that we really look at this and some of the things that you were mentioning. It just really starts to jolt us as far as the conversation that we need to have. Talking about neuropathy, talking about lymphedema, but looking at that as how if you one of the speakers for our conference is a doctor, she had lymphedema that put her in a situation she could no longer practice medicine. So having career changes because of things that you experience through cancer that may make you disabled. So I greatly appreciate this conversation and the things that you brought to the forefront.
And Sylvia,
Absolutely.
this is wink, wink. I think Vovanti would be an excellent speaker in the very near future at NCBC.
Yes.
I agree. I agree. Point taken. You're always introducing me to speakers.
Absolutely. Mary.
Hi, thanks for having me tonight. I'm a friend of Sherry's, but I'm also an attorney with the American Cancer Society, and I'm severely disabled from MS. So I am not a cancer survivor, but so much of what Dr. Jones said resonated with me on a variety of levels. I think it's incredibly valuable content, and I do hope that it's okay if I get your slides. I will share them with people at my work.
Yeah,
Because I think
absolutely.
particularly our patient services group would really benefit from them. I have been pushing with some success. It took some time, but for the organization to have more policies on disability and cancer and to sort of have a greater understanding of health equity and disparities for people with disabilities and cancer. And actually, it has really started to resonate. So I think the organization was a little slow to the party, but now it's really moving forward. So just want to let folks know that. But then the other thing was in response to the comment about disability and cancer, I just wanted to say this area can be very confusing to people. And there are sort of two different ways that the law defines disability, depending on the purpose of the underlying law. So like what I think the other commenter was speaking to was you can, under the Americans with Disabilities Act, get protection for having cancer as a disability, and the employer has to accommodate you. And that might not sound like a big deal, but actually is a really big deal, because when the Americans with Disabilities Act first passed, it was not clear, because the law basically said that a disability had to be substantially impair a life activity and basically be permanent. And cancer survivors were kind of getting hosed because they would need time off for treatment, they would need time off for rehab, but then the court was finding that they weren't considered disabled because it wasn't permanent. And so they really lost out on a lot of cases for, and they should not have lost. But then the law was amended to broaden that so that it's clear basically anybody with cancer can claim that they're disabled for the purposes of getting a reasonable accommodation from work. So that's a pretty big deal, because it's a powerful protector in the workplace. And then, of course, the other one people are probably familiar with, but disability is defined for like Social Security disability income, meaning you are getting compensated and you cannot work. So there's sort of, it's a very, I know it can be super confusing to people, but I think it's worth people understanding what the differences are, because one, like the Americans with Disabilities Act, is to empower cancer survivors to stay in the workplace and allow them to do so. And then SSDI is for, of course, if you're unable to work and you want to have income to live off of. So I just say that for the good of the order for the group.
Thank you. Thank you, Mary. Kermit, why don't you take us home?
Well, thank you, Micha. For those of you that don't know, I'm Thelma's classmate from one of Thelma's classmates from high school back in Snow Hill. And I knew Dr. Jones when she was just little Vovanti and her sister Robinetta. And I always thought that Vovanti, and I knew her better, was just so smart. But then I thought about her dad, Robert, who I went to A&T with. We went to school together at A&T, and we always knew that he was just brilliant. So, like I said, fruit does not fall far from the tree. When you talk about other people, nuts don't fall far from the tree either, but that's not the case in this instance. But what I wanted to ask Dr. Jones is this concept of that seemed to me to be much more prevalent in public health, because they tend to blend a lot of different things together and they don't look so much in the silos only. But this notion of prehabilitation, rather than being reactive, you're being proactive. You're giving information. Can you talk, how much is that viewed, and what you think the potential of that is to be able to serve many of the patients that you've talked about?
Sure. So pre-rehabilitation, I'm seeing it a lot more now. I wanted to mention that cancer rehabilitation is now a specialty in the field of physical medicine and rehabilitation. It actually requires an extra 1-year fellowship to be certified in cancer rehabilitation. And this has really come up in the past, I would say less than 10 years, where now that you can get board certified in cancer rehab. And I think this is important because I think people are realizing a lot more of what physicians, and especially rehab physicians who have the understanding of the multimodalities of rehab, can do to help stabilize these patients so that they have better outcomes overall. Because when you talk to your oncologist, they want better outcomes for their patients too, right? They want people to be able to go home and thrive and do well, or decrease risk of recurrence and or complications, because that's important to them too. And so I think more and more the field is opening up, and now they're starting to actually have cancer rehab units in the hospital for acute inpatient, like cancer rehab, with the oncologist being closely involved or talking to the physician that are running those units. So we're definitely seeing this field expand.
That is some very good news. Selfishly, I'm going to ask my question, Dr. Jones, before we leave. But It's about advocacy. Do most oncologists generally recommend cancer-related rehabilitation, or do patients and families need to advocate that this is something that they're interested in doing as a part of their treatment?
I definitely think advocacy is a big way to go about it because depending on where you are, I think, in the larger cancer centers, larger academic centers where a lot of this is built into their kind of algorithm. It's a part, getting palliative care involved early is a part of the algorithm. Thinking about getting, physical therapy involved as a part of that algorithm too, that you may see it there. But I think at some of our smaller hospitals, smaller cancer centers, or when people are not living close to those areas, that you often missed out on those things. And that's why it's important for, people like me to give these talks and go to this community groups to make them aware of what those options may be. Because I do think there's still people that don't understand um, why it's important to do some conditioning and whatnot before you go into your treatment. And it all depends on your stage of disease too. Like some diseases you got to go in right away. You don't have the opportunity for it. Where others you might be able to put things off for a couple of weeks and go from there.
Wonderful. Okay, so I think I can take your question, Sherry, because I was supposed to turn it over to Miss Thelma, who's not on camera. So now Sherry will take us home.
Vovanti, I was wondering what insurance coverage is for this type of post rehabilitative treatment and whether it's fully recognized or whether it's a battle.
So
And
I think
where the rubber meets the road.
yeah, so for rehabilitation, as long as you have like a diagnosis of fatigue or some functional kind of impairment, then we typically are able to get physical therapy, occupational therapy covered for that, as well as if you've had a surgery and you're in the hospital and you're not, they think you need a little bit more rehabilitation after your treatment, then we could have people come over to the inpatient rehab, and that's covered um, by many insurances. I never say all because there are definitely insurances that fight back or and we really have to advocate for. So all I say in the big room, insurance in the United States is such a messy situation that I can't give you you know, definites on who is going to say yes to what. But oftentimes, if you have a significant enough functional impairment when you're in the hospital, if you're coming from the hospital, then we can get at least inpatient rehab covered, and then more likely outpatient uh, if you need that further down the road.
Thank you. Dr. Vovanti Jones, thank you so much for this informative session. And she's given us a call to action, everybody. I mean, so many of us have just learned about this for the first time today, but I think that now we all should be spreading the good news of this work, and making sure that we are also advocates. So thank you again, Dr. Jones, for your work and for raising awareness, and for your time this evening. We really, really appreciate it. Alrighty, so before I turn it over to Miss Thelma, Dr. Jones was talking all about rehab. And so as you are able, whatever it looks like, I'm gonna give you guys about 10 seconds of a shakeout. If that means your shoulders, if that means your head, that means your fingers need to do something. However that looks to you, please just feel free to move your bodies, because I know we've been sitting here for about an hour 25. Um, and we still have a little bit to go for a lot of wonderful information. So, without further ado, Miss Thelma, please take us to the next portion of this amazing conversation.
Thank you, Micha. And again, thank you, Vovanti, Dr. Jones, because you have certainly um, raised the bar to a higher level in terms of broadening our knowledge and awareness about the intersectionality of cancer and disabilities. Totally new. So thank you. And I welcome anyone who loves to write and would love to write an article about this. Who knows? We may can put it in the Washington Informer. While I can't guarantee that, I know we have the Southwester here in Southwest DC who would welcome that article. So again, if you love to write and want to write this up, please see me afterwards. Now, in the journey of cancer, particularly breast cancer, we have what you call is her story. This evening, we are so fortunate to have Sherry Dinkinson, JD, to share her story. So Sherry and I have known and been working with each other now for more than a decade. We worked together through her leadership in raising $100,000 for the American Cancer Society, making strides against breast cancer. Sherry is a graduate from Albany, and through her connection, she's a very dedicated alumnus. She introduced two young students who I mentored and worked closely with me, who are graduates of her same university. And they are now in different parts of the country, but I am still very much in touch with them. Sherry is also an ambassador for the Thelma D. Jones Breast Cancer Fund, and the two of us lean on each other's ears and shoulders about the same amount. So we are good at lifting each other up. I could tell you a lot more about Sherry, but I'm going to allow her to share her story about her breast cancer journey and the outstanding advocacy work that she is doing around disabilities.
Thank you so much, Thelma. And Vovanti, I just want to thank you for that amazing presentation. And I will get back to some of my views on what you do in the medical profession. It's a month of gratitude, so I like to practice gratitude all year long, but I want to express gratitude to three special people in this group. The first, of course, is Thelma. And it starts with Thelma. If I had not gone to a Thelma D. Jones meeting, I wouldn't have met an individual named Kim Beer, who was policy director for the Christopher and Dana Reeve Foundation. And then I met Regina, who then went to work for the Christopher and Dana Reeve Foundation. And now that foundation is a huge part of my life. I feel that they do amazing work for individuals with disabilities. I am what you call a regional champion. We spent, I can't tell you how many hours working on making sure that the Paralysis Resource Center that Regina is in charge of remains part of the big, beautiful bill. We got the money reinstated in the House and the Senate. Let's hope that it stays in the CR when the CR becomes whatever. But we are lucky because there were a lot that were not. And I think it's a testament to the individuals involved in Christopher and Dana Reeve. I also want to give a huge shout out to Mary, who undermined her, a little bit of her hard work and nudging of ACS to develop a pillar in their health equity that included individuals with disabilities. It was no easy battle, and it wasn't short. And yes, they caught on, but they caught on because she kept at it. And I think that deserves a huge amount of thanks to her for that. And I had the opportunity then to speak to their ERG and then to their larger patient navigation group. I think it's critical to get the word out there. I'll keep my story short. Keep my story short. Where's the T? Story short. I really want to end with what I want to do is 3 sort of advocacy call outs. I am a quadriplegic as a result of a diving accident when I was 16. I went through countless surgeries, many that were unexpected. But the one thing that I never expected was to have cancer. And when I think about that, I wonder why it was so strange. But when you're dealing with so many other things that you feel, and Vovanti has shown us they're not so divergent, but when you're dealing with so many things that are not related to cancer, but you're so, they take up so much of your time, just your regular functions of life, and then dealing with medicine related treatment for those things, you don't expect to hear what I call the big C. Well, I can't feel from the middle of my breasts down. And so one day, 15 years ago, one of my attendants was putting my bra on and said that she felt a lump. So I can't do a breast exam. And I went and got a mammogram, and I heard some whispering, heard the word comprehensive, didn't know what that meant. And the next thing, somebody walked out and said, "We'd like to do a biopsy and we can do one now." And I was like, oh, this is a little bit. So did the biopsy, went home, and my OBGYN at the time, who I was going to every 3 months to get Depo-Provera shots, so I didn't get my period, because when you're in a wheelchair, it's hard to change those things. He never, ever, ever did a breast exam. So in hindsight, that is something that I realized, which I didn't realize at the time, was like major oversight by him. But he never even thought of it, right? And that goes to education and doctors and individuals with disabilities. And I was informed by phone that I had early stages of breast cancer. So in most of my life, medicine went slowly. Regina's on that track now. With my breast cancer, I never saw a train run so fast. And it was fast. But along that way, when I saw the oncologist and then the surgeon, they were ready to do a lumpectomy until the question came about radiation. And I said, whoa, 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 whoa. I can't feel heat. Does that mean I can have radiation? And they looked at each other and sort of thought, oh. And this was like out of the blue to them, that this is not the standard protocol for a lumpectomy. So I was not eligible for a lumpectomy, and it was my decision to get a full mastectomy, because first of all, I felt that that would increase my lack of recurrence, and that I could not tolerate a lumpectomy. So what was I going to do? Let this lump just get bigger? The other thing is because I'm a quadriplegic, I have no bones. So if I took off my shirt, all you would see is ribs. You lose tissue and musculature the longer that you're injured. And so I was not eligible for reconstruction, which meant that I would be wearing a prosthetic bra, which for many women is a big deal. Ironically, I'd been through so much before that that was like the last of my concerns. Then the question became, well, we can give you medicine that will ensure to at least you're 75%, you're not going to get it back. There's a 25% chance of recurrence. We can get that 25% down to 12. but you need to take this medicine. Well, what is one of the side effects of the medicine is osteoporosis. Well, if you sit in a wheelchair for, I'm going on 45 years or 46 years. At that time, it was 30 some years. I didn't need any help with osteoporosis. Raised my hand, I had it. I didn't want any drug that was going to enhance it. I said, no drug, no thank you. I'll take the risk. 15 years later, I don't have breast cancer. I have my theory on how I got it. Prior to being diagnosed, I was very, very ill as a result of complications for pressure sores, which is very common in individuals that are quadriplegics and other disabilities. And I was in ICU for at least 6 months with chest scans daily, multiple chest scans. There is data that pediatrics that get a lot of radiation are known to have greater incidence of cancer. I truly believe the reason I got breast cancer, there's none in my family. I'm an Ashkenazi Jew, where it's very common to have BRCA. And I was tested, I was not BRCA positive. There was no cancer in my family. So there I was, had breast cancer, got very involved with making strides against breast cancer. Fabulous organization, made me feel like a part of something bigger than me, and really getting involved with Thelma support group, just forming a group of people around you that were positive, that were thrivers and survivors. But it also got me passionate about women's health care for individuals with disabilities, which I think is highly, highly overlooked. First of all, when it comes to spinal cord injury, which is me, the majority of injuries are men. So I'm a minority within a minority. And if you're African American, then you're a triple minority. But I'm a minority. And so the lack of knowledge about breast cancer is huge. For instance, I got a call from the Paralysis Resource Center that Regina runs that says, a woman just called us and she has breast cancer and she doesn't know what to do. Can you talk to her? She was in California. There is not anyone that I could have called. Luckily, I had a very good friend that sort of coached me along the way. So a couple of things. The number one thing is getting a mammogram. I call it ugly gymnastics. The machines that are out there, yes, they raise up and down, but they're not even good for a woman with a rotator cuff injury. To be able to put your arm over it, to get your wheelchair, every wheelchair is different, next to it. So I advocate for people with disabilities to tell the radiology center, you need 2 techs, you need extra time, because it's going to take time to get you next to that machine. Now, my view is that the radiology center should be asking, do you have any condition that requires any special accommodation during your mammogram? Number one. Number two, there are machines out there. There are 2 of them in the country. One is at Craig Institute, which is a specialized institute, one of the best in the country for spinal cord injury and brain injury. And for some reason, a hospital in West Virginia, they have a machine called GIOTTI, GIOTTI. It comes to you. You don't have to go to it. Now just think, all of you, not just people with disabilities. Wouldn't that be wonderful that you didn't have to get all over into this? And what about women that are aging and getting diagnosed with breast cancer in their 80s? I've tried my hardest whenever I go and get my mammogram, but radiology facilities, even in hospitals, they have what they have. It's serviced by whoever, Simmons, GE. When it's time to buy a new machine or get a new machine, it's the same machine that's brought in. And they're not going to listen to Sherry Denkinson. They're going to listen to the radiology group saying, we need to think about different types of individuals. And maybe we should look and see if there are different kinds of technologies that are being developed every day that are going to be better for individuals with disabilities and better for everyone. My last advocacy point is there were regs that were put into effect, that go into effect supposedly in July of this year. And they're very comprehensive, but I won't get all lawyerly on you. I'm a lawyer as well. But basically, they require these three things: accessible mammography machines, accessible scales, and accessible exam tables. So these should all be present in facilities of a certain size. Now, they're not well defined, but they're required. So normally what you say, why is it important to be weighed? They'll ask me my weight. I haven't been weighed in years. The only time I was weighed is if I went and was laying on a hospital bed that had a weight in it. Well, dosages of chemo or any other drug are very, very important for others to know your weight. Because if you're not a huge individual, you get too much of a dosage, it could kill you. So it's extremely important. So these scales are required. Accessible tables that go down to 17 inches so that you can transfer onto them so that small women don't have to jump up, and that you need help transferring. There should be individuals there to help you transfer. And the accessible mammogram machines. So I am on a mission, and Vovanti has probably heard me before. I really feel I've spoken at panels at medical schools. GW invites me every year to be on a panel. That's the only school. So Thelma, I think one of our action items is going to be trying to get at least in to talk to. Vovanti was at Howard, but making sure that we get into the colleges, that medical schools around here, and talk about your fund and talk about disability to a medical school class. The New York Times, about a year ago, had a series and they interviewed doctors anonymously. And the result of this very, very well circulated article was doctors stating that they would rather not treat individuals with disabilities because they were too complicated and they took too much time. So we had the opportunity with a new, broad-minded, young group of medical students that are already taxed, but they are entering into a world of AI, of all kinds of technology, and who knows what's going to be developed within my lifetime or after my lifetime that's going to make it easier to treat individuals with disabilities already, or those now that I've learned that develop a disability based on their treatment. So I maybe went a little over my 5 minutes, but you got to hear my soapbox talk, and I'm going to talk it till the cows come home. So thank you so much for having me. Thanks to everyone who does this work every day. Vovanti, you are my hero. And I hope that I can't do it this year, but maybe next year we can both be at Sylvia's conference together. I know we'd have a blast, along with passing along a lot of knowledge to the practitioners in the room. So thank you very much.
Thank you so much, Sherry, for not only sharing your story, but sharing with us about how passionate you are as it relates to advocating around breast cancer survivors with disabilities challenge in general, and just the work that you are doing to help to ensure greater accessibility for people with disabilities. I cannot thank you enough for your passion and advocacy for that. And yes, we will follow up and working with Howard University and talking to NCBC about what it would look like with you and Vovanti there next year. I'm not for sure if they're ready for one. 2 could be overwhelming, and 3 could just really they may have to seek some mental help. But thank
Those
you.
are wonderful.
Yeah, and thank you so much.
One more shout out. If any of you at this meeting see a mama van without a lift, please report it. If you don't know who to report it to, tell Thelma, she'll tell me, and we'll make sure it's taken care of. That's yet one more problem. And then I'll say my say. I'm done for tonight. Thank you, everyone.
Thank you. Thank you again. And we have two other wonderful speakers that we want to make sure that we give them ample time. And I just want to mention that we were pleased to have with us Dr. Kermit Crawford, who said he was my high school classmate. Dr. Crawford has spoken at the Thelma D. Jones Breast Cancer Fund meeting at least 4 or 5 times since the pandemic. He is a licensed psychologist and who holds a doctorate from Boston University, now living in the great state of North Carolina. So thank you, Kermit, for being here. And so now we're going to pivot to our community, our wonderful, wonderful community partners that tonight we have two. So first we have Sylvia Powers, who is with NCVC and has probably spoken at every meeting since she first appeared last January and some other Thelma D. Jones Breast Cancer Fund activities in between that. Sylvia and I share committee work together, but rather than my taking up the time telling you about how great Sylvia is, let me just allow her to speak. Welcome, Sylvia.
Well, thank you very much. And I definitely want to be cautious of the time, but Thelma and I have a genuine love for each other. I could not believe that she accepted my invitation right off the bat to co-chair the National Consortium of Breast Centers conference, which was no easy task. We had to be on regular calls with doctors, radiologists, and people in the medical field as we help to shape what the fifth Survivors and Advocates Summit would be like. And I am ecstatic that we came up with a day of speakers and topics that are I believe are going to be life changing for anybody in the advocate space, for anybody in the survivorship space. I believe it is going to be absolutely amazing. And also, Thelma works with me on my monthly advocacy call, which we have been trying to transform, bring in speakers, and some of the speakers that speak for us are speakers that I've been introduced to Thelma. And my objective in working with the National Consortium of Breast Centers, which is an organization that basically deals with the medical field. It's an interdisciplinary organization where every aspect of patient care is dealt with, from the diagnosis to the treatment to the aftercare. In the last 5 years, they've been opening up the door for the advocacy space. So making sure that our voices collectively are heard. And I'm grateful that as December 3rd is National Disability Day, that I was able to interview Sherry. It's one thing to do a social media post and say, oh, this is National Disability Day, but I wanted to take it a step further. Let's talk about disabilities and breast cancer. And so we're going to highlight excerpts from my interview with her as we acknowledge the day. And I encourage everybody that has a social media platform, any type of a platform for the community, that we acknowledge that day. Some of the tremendous information that was shared. So we continue that dialogue. It is fabulous that Thelma has opened this door and said, let's talk about this. But for those that are advocates, this needs to be something that we're continually bringing forth. And I do look forward to the opportunity to bring this as a topic for next year. But I do want to encourage you, I'm going to put it in the chat. We are having our fifth Survivors and Advocates Summit in March. It's March the 30th in Cleveland. The entire conference is the 27th through the 30th. Would love to have you participate. For advocates, the registration fee is only $95. There are opportunities for advocates to go to the entire conference, which is absolutely phenomenal. You get a chance to have all of the medical information. And then also tomorrow, on our advocacy call, we're going to have the keynote speaker, which is Dr. Sherry Prentice. She was a physician who, after her diagnosis with breast cancer, dealing with lymphedema, had to retire from her practice. For 3 years, she became a national spokesperson for the Susan G. Komen Breast Cancer Foundation with their 3-day race. She now has her own nonprofit dealing with lymphedema. She gives out the sleeves for people that can't afford them. So she's turned her advocacy into action. And I think that's what we are all called to do. And I am grateful to be a part of the force behind Thelma, because that's what she's about. You know, her advocacy is not just just a voice, but it is volume, as she brings everybody together. She's not afraid to share information. She's not afraid to collaborate because there is power in numbers. So I am very grateful. I'll put my information in the chat if you want to reach out to me. If you do want to come to the conference, we greatly appreciate that, because we have developed a program that I think is going to be inspiring to all. And for those that need CME credits, there's also opportunities at the conference for that. Thank you so much.
Thank you, Sylvia. That was a nice, short and sweet talk about who you are, what you do, and the impact that you're making with your work with NCVC. I would be remiss to say that not only have you interviewed Sherry, you have interviewed Dr. Kermit Crawford, and I'm going to start monetizing this. And the reason why is because our next speaker, who is also, we're really rocking with the people from Texas tonight, Regina and Houston, Sylvia in Dallas, and our next speaker is from San Antonio. And she's going to be talking about a fundraising platform. So when I start monetizing all of the network that I'm connecting you with, we will be totally set in using the fundraising platform Parachute. And I'd like to bring on Cal. I hope she's still here. I don't see.
Yes, I am.
Oh, there you are. I was okay. And so, Cal, why don't you do us the honor and tell us all about Parachute?
Yes, thank you, Thelma, and thank you for having me tonight. It's been so lovely to be here with such an inspiring and incredible group. I'm going to be completely honest, I did not know what I was getting myself into with this first meeting, but I have genuinely had chills this entire time. So thank you for including me. Thank you all for sharing your stories, your resources. It's all been beyond inspiring. And I will say Thelma is always bragging about the powerful group of men and women she has connected to this cause. And so tonight I really did get to see that firsthand, and it's been amazing. So thank you all for including me. I will make this as quick as possible, but I am the founder and director of nonprofit partnerships for Parachute Donate. We are a completely free fundraising technology designed by nonprofits for nonprofits. We are the only US-based company to provide these online giving tools for nonprofits here in the US, and we really wear that as a badge of honor. We realize that, especially in today's climate, but any day, anytime, every single penny is mission critical, and we want to make sure that it's not getting lost in miscellaneous platform fees and processing fees and all of that. So we have been so proud to partner with Thelma just over the last few months to really maximize the impact of every single gift that is given to the Thelma D. Jones Breast Cancer Fund. And we do that by providing technology that passes through 100% of every gift. So it is completely free to sign up, free to launch all of your fundraising campaigns and initiatives, free to manage and communicate donor relationships. And we even cover the credit card processing fees imposed by our payment processing partner, which again means just every single penny is going to the mission, the people and places that every nonprofit that we work with is, in motion to support. And outside of the donation processing, it has just been such a pleasure to work alongside Thelma and Sergio and the team to really assist with their campaign creation, bring, the powerful thoughts and feelings that Thelma and this group has to life through campaigns and donor communication strategies. And, that's all part of our services that we offer, again, for free. We dub these white glove services, and it's designed to help nonprofits of all sizes, causes, locations, stages of development, really to either, hit the ground running or kind of change an approach or try new things and test what success looks like. And with that, I will wrap it up by saying if you are a donor or in a place to contribute tonight, I really encourage you to support the critical work that Thelma and her team are doing by donating. There's a button on her website. You can feel confident in knowing that every single penny of your gift is going to go to the work that Thelma, and again, this whole group is just committed to doing. Separately, I know there are a lot of people on here connected to various nonprofits or advocacy groups that maybe process donations or want to start processing donations. We also offer free fiscal sponsorships to companies or projects or people looking for, 501c3 status and support for their donors. That is an option as well. But if you work with a nonprofit or know a nonprofit that could benefit from saving multiple percentage points on every gift processed, most of our nonprofit partners are saving between 3 to 10% of every gift made online. That is how much they're typically losing in various fees. So again, today, every day, every single penny is so, so critical, and we want to make sure that the nonprofits feel the full benefit of that. So if you're in a place to give, please do that. If you are connected to a nonprofit, I'll put my contact information in the chat and we can go from there. And I know Thelma has additional resources on who we are and what we do, and she can pass those along as well. But thank you for allowing me to jump on here today and share a little bit more about our company, but also our partnership with Thelma. She, as you all know, is just a dream to work with and brightens my whole day every time I talk to her. So joining this group was just an extension of that. So thank you all for your time.
Oh, thank you, Cal. That was absolutely wonderful. And I just want to share that how wonderful Cal and Greg Earl, who is a fellow Leadership Greater Washington fellow of mine, which is how our connection came to an existence and fruition. But the thing that I like about working with Cal and Greg is I have never felt like I was working with that pushy car salesperson. Well, if you don't get it today, the interest rates are going to go up, or, well, if you don't do it, we may have to ask someone else. That is not the kind of thing. They're very patient with me, and we entered this partnership to improve our fundraising platform. But the help that I have gotten from them has gone far beyond that. And that much I love. And as a result of this, I feel very confident in recommending or endorsing their work, and think that if you are considering a different fundraiser platform, I can't think of a better one or more efficient one than Parachute. So thank you again, Cal, and we will stay in touch.
Yes, we will. Thank you for that. Appreciate it.
You're welcome. And so next, moving right along.
Yeah.
Is,
No, I was going to say, This has just been so amazing. So I want to make sure, Kyle, we have all your info in the chat so that folks know, as well as Sylvia's info. And I will make sure I put mine as well. But I think without further ado, it is time to turn it back to Regina for some closing remarks. And I don't think I said it before, but for everybody, I just want to, I mean, again, I think Kyle used the word inspirational chills the whole time, but also sharing your stories. You know, I talked a little bit earlier in the conversation about being walking testimonies and why that's so important. And so, you know, Regina, I think we, in all way, many of us can empathize about a long, arduous journey of diagnoses, etc. And the smile that you just have on your face and the calls to action you've given us have fired us all up. And Sherry and everybody, just thank you so much for Karen, Sylvia, Mary. Thank you all for sharing your stories. It's been great. Regina.
Wow, this has been fantastic. Thank you all so much. As we come to a close, I want to return us back to the people who brought us together tonight. That's Miss Thelma. Thank you so much. To Sherry, your advocacy, your leadership within the Christopher and Dana Reeve Foundation, and your role, as you mentioned, as a regional champion, show what is possible when we refuse to be boxed in by assumptions. I think Gerard will be proud of you. To Miss Mallory in Panama, thank you for your partnership and everything that you're doing to support this group for being in existence every November. Also to our speakers, to Micha, your MC skills are so on point. To Dr. Jones, Sherry, Sylvia, Kyle, thank you all so much for all of your words today. And I'm here, as Sherry said, I worked at ACL and I knew indirectly about Thelma D. Jones, but I didn't know much about it. But I got to know Kim even more, and I left federal government and I became a part of the Christopher and Dana Reeve Foundation. I've been there now for 3 years. So Ms. Thelma does more than connect people. She transforms people's lives. And so I'm truly thankful for having her in my life. And the partnership that we've had with the Christopher and Dana Reeve Foundation, with the Thelma D. Jones Breast Cancer Fund, has been absolutely fabulous. It started out with Kim Beer. I think Gerard has even been a part in the past, and I'm continuing the torch, and we'll have many more participate. Sherry has been thoroughly involved, and it's really important because the presence means that people with disabilities, people living with paralysis, we're seen, we're heard, and we're centered in conversations about breast health and cancer. And that isn't something that is always talked about. Lastly, I want to thank all of you, each one of you being here, to the survivors, the thrivers, the caregivers, allies. Thank you for showing up. Your presence is powerful. As a reminder, it is National Family Caregivers Month. So if you know a caregiver, say hi more than once, hug them, thank them, air hug them if you're on a Zoom call in the future. We need caregivers all the time, so thank you for what you do. And I'm gonna try to add to this, Micah. I'm gonna give you 3 things to take away as you end your night. First, your presence matters. So thank you. You being here isn't small. You're sharing your story, even when it's uncomfortable. You can open the door and help somebody else and they're probably struggling. I did that today. Your voice matters. The statistics are very clear. People with disabilities, especially women, are particularly women of color, we face serious barriers to screenings, diagnoses, and treatment. The system isn't really built for us. So we need to make sure that we are active and engaged and being advocates and making sure that we are in control of our bodies and helping people understand that our voice matters. Third thing, gratitude and truth can live together. That's called thankful truth. Share it with a friend, share it with your network. Being thankful does not mean pretending that everything is fine. It means saying, yes, it has been hard. Yes, there have been disparities. Yes, I have been hurt or delayed or dismissed, and I am still grateful. I am still grateful for my breath, for my community, for the people who have stood by me, for the leaders like Miss Thelma who paved the way, and for the chance for pushing for better. So thank y'all again. You can find me at the Christopher Reeve, ChristopherReeve.org. You can always find me through Miss Thelma, and I appreciate everything that y'all are doing. Have a wonderful night and be blessed.
Thank you so much. Thank you.
Thank you.
Yes, thank you.
Micha, should
Yes,
we
happy
move over to
Thanksgiving.
you?
Oh, I said Michael,
Me-
Misha. Sorry, Misha.
Okay.
No, look, I think that was such an amazing way to take us home. Those 3 bullet points. I'm just gonna reiterate. Our presence matters, our voice matters, and gratitude and truth can live together. Thankful truth. Oh my goodness. Again, I'm stealing that word from Kyle. I have chills after this. Miss Thelma, thank you for your fearless work, your advocacy. Regina said it best. You are not only a dot connector, but you really are someone who transforms lives. You know, who thought that we were going to learn something new today on a Wednesday afternoon? I thought we were going to have a robust conversation, certainly. But I mean, I am just really fired up. I think that this has not only been something for us to think about, but a call to action in so many ways. And so we can't take this conversation and keep it moving. It's the holiday season, and we know that sharing is caring. And let's make sure that our village knows about everything we've learned today and that we are doing the work to ensure that we are combating all of the challenges that we talked about and empowering and uplifting all of the work that's happening in order to ensure that that health equity for all is certainly achievable. Oh, Miss Thelma, thank you so much. Gratitude is the word today. And so we are so thankful for the work that you do. And please, please don't forget about the Washington Informer as these conversations continue. We want to make sure that we're covering it. And you all have given me a lot to make sure that our health writer follows up on. So thank you all again. Blessings and all the best to you all this Wednesday and always. And let's be fierce and fabulous, as Regina says, as we move on. Thank you all.
Thank you.
Thank
Just want to
you.
add a small invitation for if you had material to share on the website, it would be nice to link it to all the work that you do. And we can display it on the website so they can go through your own material and make a direct connection.
Yes. Thank
Mhm.
you.
Yes, that will be all. But thank you for everything.
Thank you.
Thank you.
Thank y'all.
Good
Have a
night.
good
Good,
night.
everybody.
Have a good Thanksgiving.
Happy
Yes,
Happy
Thanksgiving.
Thanksgiving.
Yes.
Thanksgiving.
Regina, so good to see you.
Hi,
Thank you,
Angie.
Lily.
Good to
How are
see
you
you.
And Miss
doing?
Micah, you were fabulous.
Thank you.
We're good. Missing you, missing you.
Oh no, I'll be back more often now.
Okay.
Yes,
Thank
can't wait
you.
to see you
Hi,
guys.
Arnett.
Yes.
Yes.
Hi, Regina.
Ah.
I won't scream you out on the corner anymore,
Oh,
Regina.
thank you, Cynthia. Thank you.
Regina, we would like those pictures that you posted on when you were talking.
Okay, and I'll get some more. It was like last minute. I was like, oh, let me go and pull some pictures. So there are even better ones. So I'll put together a little better kind of collage type thing to remind us of our time together. It was so fun.
Yay.
Wonderful. And we'll post them on the website. And I apologize that I'm not listing you as an ambassador. Your nice remark, tactful remark, said that you were. No, you still are, and I had to update
Yes.
that list to include you.
Thank
No,
you.
it wasn't an out of sight, out of mind kind of thing. It was just out of sight. But
Oh no, I totally understand. Totally understand.
Tell Jay hello.
I will. I
Oh,
will.
yes.
Y'all
Everybody
good
have a
night.
wonderful Thanksgiving. And Miss Micah, thank you so much. You are a
Okay.
jewel.
Thank you, Misha. Thank you.
Misha.
Yes, I'm sorry, Misha. I said
I
your name
pronounced
wrong.
it.
I'm
I
so
missed it. Yeah, I did
sorry.
too. I do apologize.
The spelling is, my dad is Michael. So I've been Micah, Little Mike. Y'all know I look like my mama, but I sound and navigate the world like Mike Green. So
There you go.
it's always that.
There we go.
Really blessings to you all.
Blessings, my sister.
I have this long list really of stories I want to make sure we follow up on. So I know Miss Thelma will hold me accountable for that. Personally. But please reach out to me as things come up. You know, these are universal stories that need to be told. So whether it's you know, a story that's happening in Houston or wherever, we can still connect it to what's happening here and certainly for our people. So please keep us posted.
Fantastic.
Hi, Anthea.
Hi.
Hi, Arnett. It's a
Is
roll
she still
call.
there?
Is that
Yeah,
is that
Arnett is still showing.
Is that Sister Scarlett there? It definitely
Yes, it is.
Yes, yes.
Is that Sam?
Yes, my darling.
Oh, she got a new iPhone.
new
Okay.
iPhone. Yes, and where's my boy? I miss him so much.
Who, Jay?
Yes.
Oh, can you come through, Jay?
Yay.
He's got to come close so he can get through the background.
Oh, yes.
Oh.
You got to come close.
Come on in there, Jay.
Close.
There you go. There you go. Hey, Jay. See you.
There you go.
There he is.
And he's still as cute as ever.
Oh my God, isn't he? He looks like he's getting younger.
Yeah, he is still cute as ever. You must be taking good care of him, Regina.
I try. He's taking care of me.
Yes. That's wonderful.
You're taking good care of each other.
Yeah.
There you go. That's it.
Happy Thanksgiving, everybody.
Happy Thanksgiving. Love you guys. Love you all.
I love
Peace
you.
and blessings. Blessings.
Yes. And be safe. So Thelma, you're having a mini class reunion each month, I see. So you had several class members on, I know.
Yes, I had 3 classmates on. You're correct.
Vovanti's father, Robert, was on.
I know, and I mentioned him, but I never called his name. Yeah. So
Bye. Bye-bye, guys.
Good night, guys.
all right. Take care, everybody.